I think in healthcare, there's a lot of systems that just have dead ends, whether they're intentional or whether they are, set it and forget it and never come back to it. For me, a dead end was I wasn't willing to sleep in a sleep lab.
How do you measure success?
Effectively, there's kind of three ways that we measure success. One is whether or not patients are actually getting to an outcome that is an improved outcome for them.
GEM started with sleep apnea, but the tagline is connecting the dots in specialty healthcare. Where do you see GEM Health expanding next?
It's incredibly challenging even to get good at doing one thing. Our team has a good blend of experience in sleep and just experience in digital health that I think kind of allows us to push the boundaries a little bit.
If you could put one message on a billboard for every healthcare leader to see, what would it say?
Put the patient first. The beginning of the day, if you're thinking about what the patient needs and kind of building your tech and your experience and your messaging around what the patient needs, not just around what your strengths and capabilities are, I think that you keep, a true north on why we're doing this.
All right, we are live. We have Brian Sauer from GEM Health on the podcast today. Welcome to the show, Brian.
Thanks, Alex. Thanks for having me.
Welcome, Brian. Happy to have you. Appreciate the time today.
Absolutely.
Awesome. So, usually the way we kind of start off is we just want to know a little bit more about Brian, a little bit more about GEM for anyone who doesn't know you or your company. Tell us a little bit of background story if you could.
Yeah, I'll start off a little bit about myself. I'm a 20-plus year healthcare veteran. I've spent most of my career either helping build businesses or turn around businesses. I spent a bulk of my career at United Health Group at Optum. And then most recently, before I started GEM, I was the CEO of a startup called Sedvello Health. We were a virtual mental health company helping people with stress, depression, anxiety. And about 3.5 years ago, I started GEM Health, and it actually is a bit of a personal matter in terms of why I started it. I was somebody who was dealing with sleep apnea. I wasn't sleeping well. I was kind of not excited about going a traditional route and waiting 3 to 4 months to do a sleep study in a lab. And I felt like it could be done in a much, better way. And when I started looking at all the options that were out there, I felt like there was an option or an opportunity to do something, more unique and better in this space. And that's why I started GEM. And what we do at GEM, we're a virtual clinic who has integrated all the way through treatment. So oftentimes you see virtual clinics out there that might just do virtual visits or they might just do sleep testing, but then they kind of leave you on your own to figure out how do I, deal with this new condition such as obstructive sleep apnea that I have now. And what we've done is incorporate a treatment path for patients and also a support program to really make sure that once people get started on treatment, that they can stick with it and get the results and outcomes they're looking for.
That's awesome. Really exciting stuff, Brian. Just to dive a little bit deeper, what gaps in sleep apnea stood out to you most as both a patient and a healthcare executive?
Yeah, well, I think in healthcare, there's a lot of systems that just have dead ends, whether they're intentional or whether they are, set it and forget it and never come back to it. There's just a lot of dead ends, both from a consumer perspective, patient perspective, but also from a provider perspective. So when I was going through the process, there were a number of dead ends. For me, a dead end was I wasn't willing to sleep in a sleep lab. Another dead end was when I did find options to do online studies, almost all of them were a cash pay option, which I felt like was maybe not a dead end for me, but would be a dead end for many people who maybe weren't willing or didn't have the means to pay for those services out of pocket. And then I did go through a service that helped me get diagnosed at home. But basically then it was like, okay, I'm going to sell you a CPAP and good luck. And I didn't really feel like, I was ready to do a CPAP actually. And I certainly didn't feel like it was just an e-com experience I was looking for. I was looking for, a more supported experience. So those are just a few examples, something not being insurance covered, something, feeling not like a clinical experience or a support experience, but feeling like more like an e-com experience. And then also, the services out there, having dead ends for patients where they maybe would get started, but then they would still have fits and starts and not be able to work their way all the way through it. And those were some of the things we felt like we could solve at GEM. Really, we aim to have an awesome patient experience, clinically sound experience, and one that's covered by insurance. And that's what we've aimed to do. And that's what we're continuing to build out.
That's awesome. Yeah, definitely a trend in patients of all ages looking for a more Amazon-like or digital experience. So for anyone listening, I definitely suggest they check out your website. I love your guys' website. It's super clean, modern. Like if I was a patient, I'd be like, I'm going to use this guy just because they have a really nice looking website. But there's a whole flow to us. Can you kind of walk us through like a patient journey? So if I believe it's gem.health. If correct me if I'm wrong. If they hit your website, can you kind of take us through the journey of what they can expect and I guess how it differs or could alleviate some of the frustrations that you might have had as a patient and they might be experienced until they stumble across your website?
Yeah, absolutely. Yeah, we actually have gem.health, which is kind of our, kind of corporate website. And then the website most of our patients find is mygemsleep.com. And Gem Sleep, think of Gem Health as kind of our company in terms of we're trying to explore improving, health categories. And our main product right now is Gem Sleep from a product perspective. And really what we wanted to do is we wanted to meet people where they're at from their journey. So if you're somebody who thinks you might have sleep apnea, but you don't even know where to start, we can get you started all the way at the beginning of the journey. We do a simple sleep assessment to understand whether or not we think we can maybe help you or not. We're not looking to just schedule you right into a virtual visit if you're not showing signs or symptoms of something we can help you with. So that simple assessment can be how you start right at the beginning. But some people maybe already know they have sleep apnea, but got stuck or frustrated with what do I do about it? How do I start treatment? So if you're in that situation, we can pick up from the perspective of you already been diagnosed, you already have a prescription, but now you need to get started with treatment. Or some people maybe are already on treatment, but they're looking for a simpler process to get resupply of CPAP supplies, or maybe they're looking for a coach or support to help them, work through their treatment because they feel like they don't have the right mask set up, or they feel like they don't know if the treatment they're getting is working the way that they expect it to work. So really the idea, we call the model kind of internally DTS, diagnosis, treatment, support. So the idea is if you need diagnosis through support, we can do that. But if you need treatment support, we can pick up there. I'd say the majority of our patients, though, start all the way at the beginning. They're trying to figure out, what's going on with me. They know they're not sleeping well. Maybe their, bed partner has been reminding them that on an often basis, saying, "Hey, you not only are you not sleeping well, I'm not sleeping well because you're, keeping me up all night." But typically, people are picking up at that point. Most of our patients are picking up at that point. But then they're telling us, similar to my experience, they really appreciate that they can get help all the way through that experience, if you will. It's all done on our website. It's a web app, so you don't have to download a mobile app on your phone. But most people, probably 95% of people, 95% people are using it on their phone. But then you just basically walk through the experience, and it kind of, step by step tells you how long you can expect, how long it will take for your results to come back, and everything's very timely. We can get you set up with a virtual visit typically within a few days. We can get you a home sleep test typically within 7 to 10 days, and get that result back to you typically within 24 to 48 hours of taking the test. And then if you decide to go with a CPAP, for instance, we can typically get that out in another 5 to 7 days. So you're looking at an end-to-end experience to get from that, from not knowing if you have sleep apnea to being diagnosed and treated in, roughly 2 weeks, 2 to 3 weeks. And that compares to in some areas in the country, you might not even be able to get a referral into a sleep doctor for 2 to 3 months.
Gotcha. I was going to ask you what is the delta or how much are you speeding up this process? But yeah, you took the words out of my mouth.
Yeah, I
that,
feel
that
like
that's a huge change from 2 to 3 months to 2 to 3 weeks. That's pretty incredible.
and just the convenience is amazing. I feel like if I was somebody who was struggling with sleep or thought I had these problems, this is the exact path that I personally would want to take rather than go and sleep in some sleep center or some facility and have all these doctors looking at me or whatever the case is. But this seems just like way more streamlined and way more up my alley personally, for sure.
Yeah. I feel like it's with the sleep stuff, like I don't know if saying people are in denial about it, but sometimes they don't fully know if they have it or they think I couldn't have that. And they're very reluctant to actually go into a big lab that probably feels daunting and a huge commitment. So yeah, this is the path I would take also.
Yeah, and we're constantly getting feedback on is it the path most people like, and we have really strong net promoter scores. So net promoter being, would you recommend this to a friend or family member? Our net promoter scores are 70 plus, which tells us, most of our patients, really do, find value in this. But we do have some patients who are looking for a higher touch, service, and we do get feedback at times that people are looking for a higher touch service. And we understand that, our solution isn't going to work for every single person because it is, built more to support people who are used to doing things more in a self-service type of fashion and are looking for that streamlined, convenient process. But in those cases, we don't just leave, people hanging. We can refer them to a lab. We think there's a lot of situations where a lab still makes sense,
Sure.
in terms of if you're, dealing with maybe multiple sleep conditions, or maybe you're dealing with a situation where it would make sense to determine if you need oxygen in combination with, a CPAP, for instance. So there's definitely use cases where, we will, connect people with somebody, or a lab, or a service that can help them in a higher touch level. But we built, we think, for the 90 to 95% of people who are looking for the streamlined, efficient, convenient, kind of self-service type of approach.
Sure. I
Totally.
think it actually probably goes a long way with the 5% saying, hey, this might not be the right path. Let me, introduce you to a lab or help still guide you. So I love that.
How did your background in consumer engagement and payer strategy shape how you built this whole process?
Yeah, so at the heart, I'm kind of both a product and an ops guy in terms of my background. So, from a product perspective, I'm always thinking about, what would I like, from a experience, and is that the same thing that an Alex or a Wayne, would expect from an experience perspective. So, we didn't set out just to kind of take a set of clinical protocols and, say now on the web. I mean, and there are a lot of services out there that can connect you to a clinician, but it feels like you're pushing a button for a callback. It doesn't feel like you're, pushing a button for kind of a next, best action, if you will. So I feel like my experience, seeing a lot of what doesn't work. I ran some programs in my day that people hated, and they were programs that I kind of inherited and said, well, we can't keep doing things this way. But it was kind of my lesson to say, just having, checking the box to say you have clinicians out there, or you have the protocols, et cetera, doesn't mean that you're actually going to get people want to use those services. So you have to take that feedback. And back in my day, what I would do is I would go and sit and listen to, calls with patients, to understand what they're looking for, look at customer service feedback, all these types of things to understand, what are people really looking like. And in this particular situation, I was able to use both kind of my experience helping build kind of consumer grade healthcare products, but my own situation as well. I was patient one, if you will, for Gem to say, well, what did I want that I didn't get? And then what I did is went out and talked to a lot of patients, said, this is what I was looking for. Is this the same thing you're looking for? And I personally test out all of our, I test out all the different sleep tests, partners that we use. I test on all the masks. I test on all the CPAP machines, et cetera, for offering them to understand, if this is something I would want to use or not, to determine if I think it'd be something that our patients would want. Your second part of your question is, it's great you can build these products, but if you can't find distribution with products, you kind of don't have a company, right? And so for me, I felt like, our strengths weren't necessarily to kind of create, an e-com, business. I'm not an e-com guy per se. I'm somebody who builds kind of commercial grade programs, but then connects them with insurance. And by and large, when you talk to healthcare consumers, they're not wanting to, spend their first dollar out of pocket for healthcare services. They want those services to come from the insurance. I don't know this exactly, but I would venture to say that probably the second or third biggest deduction from everyone's paycheck after taxes and after retirement, if they put money towards a retirement account, is healthcare. So when people are putting all this money towards healthcare, they want to know that healthcare insurance, and the cost that they're putting can work for them. And so having a service, that's insurance covered is a significantly more intriguing or, appealing offering. In our own data, we started as a cash pay only business, primarily because we didn't have credibility yet to be able to, offer our services through insurance. And we saw, we measured everything. look at the rates by people adopting our services when they're cash pay versus look at our services and adoption when people have the option of using the insurance. And the rate of uptake once we offered insurance versus cash pay is orders of magnitude higher, which confirmed our expectations that people were really looking for these services to be covered by insurance.
How do you convince payers and providers that home-based solutions like GEM are the future? And is it taking this evidence and presenting it to them? Is there already programs in place? What does the payer side of this look like?
Yeah, just like anything, there has to be a mutual, a mutual interest. So I say that because just putting our value proposition out, we could put our value proposition out to 4 or 5 different payers who we're trying to work with. And if one or two of them don't care about sleep or haven't prioritized that or don't feel like it's a meaningful category for them, they might not be interested in even hearing our story. But those payers who have prioritized and see this as an opportunity, combined with the value proposition we have and how we bring, savings to them, then we find a really nice match. And what we found is that oftentimes the payers who are most interested are the most progressive ones in terms of thinking about virtual care. They're the most progressive at looking at their cost categories. They're the most progressive at looking at their feedback from their membership groups on the experiences that they're offering to them. And when we come in and hit those different value points to say, hey, we can lower episode costs, we can make you shine by you offering a service that has really high net promoter scores. We can make you look good by offering a service that is much more convenient and timely. We can save money on the back end as well by helping to prevent people elevating to other conditions that are associated with untreated sleep apnea. All those things really end up hitting the mark and allow us to shine in terms of the services that we're offering.
How do you measure success? Is it really adherence? Is it patient satisfaction, reduce costs, or something else in there?
Yeah, I've kind of sprinkled in some of our value prop as we've been talking, but effectively, there's kind of 3 ways that I would say we measure success. One is whether or not patients are actually getting to an outcome that is an improved outcome for them. So, that can be measured by things like reduction in AHI, which is I'll give you the non-scientific. I know you guys know this a little bit, but for anybody who maybe doesn't know, seriously, how many times are you pausing your breathing per hour? If we can show reductions in that, if we can show improvements in your sleep quality, if we can show that you're complying with your therapy, that ultimately helps you understand that there's a ton of studies out there that show if you comply with your therapy, you reduce risk factors for strokes, heart attacks, high blood pressure, diabetes, etc. So that first one is kind of getting to clinical outcomes, if you will, or quality of life outcomes that really matter to you. The second is whether or not you find the service to be, of value. So we talked about that a little bit. So measuring things like net promoter score, customer satisfaction, ease of use, those are outcomes that help us know that not only do we provide a service that's improving someone's quality of life and improving the quality of their health, but we're doing it in a way that they think, meets their needs or expectations or exceeds their needs and expectations. And the third is helping to save costs. So not only can we help payers save money by doing things the way we do things, we can also help patients. So if a patient's on a high deductible health plan, for instance, and they're having to pay for 4 or 5, 6 different visits to get to a confirmed diagnosis, that's a significant amount of money coming out of their pocket. Might be $1,000 to $1,500 for them to get to a confirmed diagnosis. In our process, we can get them, through a diagnosis episode, in the neighborhood of $300 to $400. So from that perspective, we're saving them, 3x, what they would have gone through to go through more of a traditional path.
Brian, you mentioned outcomes, and a common theme just in DME in general. At the end of the day, it's all about the patient. Is there any particular stories, either from a patient or a family of a patient, that reminds you kind of why GEM exists and motivates you to keep kind of pushing things forward and innovating in the space?
Yeah, absolutely. Well, there's this old notion that if you kind of solve a problem for yourself, then you can solve problems for others. So that was kind of what inspired me in the first place. But I have so many people who reach out to me on a personal level, say, like it might be a former coworker says, my husband's not, not sleeping well. It's driving me crazy. What can I do? Or people who go through the gem experience and they tell me after that they checked it out because they knew what I was working on, and they're super pleased and it exceeded their expectations. Those ones I take a little bit of a grain of salt because there may be a relationship there already.
Mhm.
But we're constantly getting, feedback from patients unsolicited that we've, beat their expectations, their time, convenience, costs, etc. And those are absolutely kind of the inspirations. It's very inspiring to, see our business grow, for us to, see the numbers in terms of like, hey, we're helping thousands of patients. That's very inspiring. But the thing that's kind of the extra fuel at the end of the day, Wayne, is just like what you're asking about. It's those, it's those kind of poster child, cases where we're like, yes, this is why we're doing it. We just had one on our Facebook community a week or so ago where they basically kind of said back to us our value proposition, like
Love that.
timely, convenience, cost saving, how could it be any easier? We're like, yes, that's exactly what we're trying to do.
It's nice
That's
when
awesome.
things work, right?
Yeah. And it's
And
not, I
you,
mean, yeah, we're a startup.
yeah,
I wouldn't be able to sit here with a straight face and tell you we got everything figured out. We do have patients at times who tell us that we didn't meet their expectations, but you know what? We review every single one of those points of feedback, and we work to not have it be a recurring theme. At times, maybe we didn't do something and didn't meet someone's expectations, but then we personally, figure out what can we do better or different next time so that we can improve on that.
yeah. The feedback loop and actually listening to it and then using that to get a little bit better is so critical in startup. So totally appreciate that. Let me ask you, what looking ahead, what excites you the most about the potential of technology in our space and just healthcare in general?
And kind of going off of that, for some reason, AI seems to be the topic that
Yep.
is on every episode. So definitely want to give you a platform to be able to talk on it, or at least sprinkle some in if you want.
Yeah, I'm not familiar with AI. If you guys can tell me a little bit more about
I
what
don't
that
know.
is and why it's such a buzz right now. Yeah, it's amazing. 6 years ago when I was running my last company, it took us 3 years to get across half the country from a coverage perspective, just because there weren't enabling technologies built to support telehealth like they are now, virtual health. Everything from being able to get clinicians licensed in multiple states to you know plugins that can plug into kind of your native tech stack that can allow virtual visits and things like that. Just the speed that you can move now to to get something up and running and with good coverage from kind of a state coverage perspective is it's changed significantly, and it improves every single day. We got a product from concept to in market in 6 months, whereas, and this was 3.5 years ago, whereas when I launched my last company, it probably took us 2 times that long to get something in market, and we had a lot more resources. Now with AI, I'd venture to say some of the things that took us 6 months to do, we could probably do in 6 weeks or less. There's significant improvements that are happening every day. But I think the thing that's really important to think about in healthcare is what deserves a human touch and what deserves kind of a technology touch. We're embracing things like, AI where it makes sense in terms of, other things that we can, move a process forward without, that maybe was a light touch before and now it can be a no touch. Or can we integrate tools and systems in a way before that it would taken us, more time and coding and development to do, that we can now put out and test in a,
For
in a
sure.
much easier fashion. That's how we're embracing it, really on a day in and day out basis. But there's so much more to come. I don't think it's very going to be very long until AI is and likely is already kind of diagnosing people. But most standards for medicine still require that there's a human interpretation and confirmation that I think would put us in a situation where AI can't just completely, come in and do what needs to be done. But I think the capabilities are probably going to be there much sooner than the kind of policies and guidelines will allow it. And that's where I think there's a lot that remains to be seen in terms of how does that all change in this environment, because something that might be a process or a protocol could likely be taken over or replaced with AI, but will it actually be in practice? I think there's a lot of outstanding questions on that.
Yeah, there's a lot
Yeah.
of companies that like to keep the human in the loop. We hear that a lot in this space, and it's funny. We actually had Todd Usher from Tactical Back Office on one of the episodes recently, and he was talking about AI being actual intelligence. So keeping the people involved in the process is so key. And I think that's really what it comes down to, at least at this point, is making sure that you're using AI, but you're also using the right people in the process as well who know how to use AI as well.
Yeah, absolutely.
Brian, GEM started with sleep apnea, but the tagline is connecting the dots in specialty healthcare. Where do you see GEM Health expanding next? Are there other therapies or diagnosis codes that you guys may be looking to provide a suite of services versus just sleep, or are you guys hyper focused on just kind of one area?
Yeah. Well, it's incredibly challenging even to get good at doing one
Yeah.
thing, and that's why we have been hyper focused on obstructive sleep apnea, because even though I have obstructive sleep apnea, I'm not, I'm new to the sleep space and building a
Hmm.
business around it. And our team has a good blend of experience in sleep and just experience in digital health that I think, kind of allows us to push the boundaries a little bit versus if we just had people who only knew, sleep and only knew obstructive sleep apnea, for instance. But the natural progression, so there's kind of two ways to think about it in my mind. One is how can you get really good at something without being distracted? So that's kind of one part of the path. The other part of the path is what do you become good at that is then value added to patients? So as we become good at sleep apnea, we recognize many of our patients are also looking for help in other sleep conditions. Roughly a third of our patients are telling us they need help with insomnia. So, we're building out, capabilities and partnerships to support that. We have a lot of patients who are asking about, expanded treatment options, in sleep apnea, such as GLP. So we're, figuring out how do we support patients from that perspective in a responsible way. So there's still a fair amount of work to be done in the sleep space. But yes, Wayne, our thought here is that if you can do the hard stuff in healthcare, it's not easy to, contract with insurers. It's not easy to build a patient grade experience. It's not easy to build all the infrastructure needed to practice medicine, or manage the practice of medicine across many states. So if we can figure out those hard things, which, many entrepreneurs are trying to figure out, on different conditions, and our patients could benefit from us supporting them in other ways, then it makes sense for us to, add, if you will, the clinical chops in other conditions. If we already have all the infrastructure in place to support, then oftentimes takes a significant amount of time and investment to build out. So I do anticipate us going beyond sleep. When that happens, we'll kind of hold our tongue a little bit in terms of that. But I do anticipate all the infrastructure and all of the capabilities we've built allowing for that.
That's awesome. I just want to take a quick step back. I meant to ask you earlier. Do you guys also help with the resupply of the ongoing PAP supplies? Is that in your wheelhouse as well? Do you have solutions for that? I feel like resupply is always such a big topic. I feel like at least to hear your 2 cents on it and how you guys are helping and innovating in on that side of the equation.
Yeah, we are. We are doing resupply, from the perspective of what are patients looking for from us. They are looking for resupply from us, but they're looking for it in a manner that, makes sense. I think that to a certain extent, resupply has been something where patients, the amount of resupply patients get offered and the amount of resupply they're looking for aren't always in balance.
Hmm.
And that's kind of one part of the challenge. The other part of the challenge is, how do you make sure that patients are getting outcomes and support so that resupply makes sense for them and understand the connection between resupply and their outcomes. So from that perspective, resupply for us really goes hand in hand with kind of our coaching and support program, so that if people are seeing, degradation, for instance, in their numbers, that we can, jump in and say, hey, you're seeing an increase in your AHI level, and it also looks like you haven't, replaced your mask in 6 months. Looks like mass leakage and, degradation results are kind of hand in hand here. So it makes sense for us to get you, connected, and let's look back at the data and show you that, there's been a change in the quality of your sleep that's going with a degradation in your equipment. So then it's people making the connection and understanding, okay, this is why I'm, changing and resupplying, not because, somebody somewhere, put on a protocol that said every 3 months I get this, every 6 months I get that, when it may not make sense. And then you also, if you're not connecting to the data, you might get that resupply and not change, and then wonder why your, results are not improving. And meanwhile, you've got a closet full of masks and hoses and things that you're not understanding that those, things have an influence on your quality of your sleep.
And I think that just goes back to the big picture that and kind of speaks to how customer first Gem is just in general. It's not so much, hey, you can technically get it, but do you actually need it? So I think that's awesome to hear kind of how a different approach there in terms of truly consumer first.
Yeah, absolutely. And we also are believers in oral appliance therapy as well.
Mhm.
It hasn't been something that we have been able to do at a scale yet. We have a few things in motion that will bring more oral appliance options to patients. But from that perspective, CPAP, we know it works for people who are able to work through the kind of transition and the transition period of getting used to it, and kind of the, making it a habit, if you will, and seeing the benefits of it. But we also know that some patients can't or won't tolerate CPAP and are looking for other options, such as oral appliances, that can make a lot of sense for people as well.
Hey, Brian, let me ask you this. If you could put one message on a billboard for every healthcare leader to see, what would it say?
For every healthcare leader to see, I think I would say, put the patient first. I think there's a number of companies that are out there that are doing things well, but at times I feel like, what they're showing is their, particular capability. They're either coming to market and they're too clinically oriented and they forget about the patient experience, or they come to market and they think about what do the providers need, and they forget that, in practicing, and the providers practicing, they're maybe missing what the patient needs. Or they're a very technology savvy company, but the tech may or may not, be, what the patient's looking for. Or they're amazing marketers, they're brand builders, and then they don't understand what, they can even do for a patient or can't do for a patient. So I think at the beginning of the day, if you're thinking about what the patient needs, and kind of building your tech and your experience and your messaging around what the patient needs, not just around, what your strengths and capabilities are, I think that you keep, a true north on why we're doing this. Because, many people, who are you know evolving and creating innovation in the healthcare space could be doing other things. So why did you choose healthcare? Did you choose it for the patient, or why did you choose it?
Yeah, that makes a lot of sense. Yeah, making sure you're putting the patient first. It makes sense when you're saying put like if they're at the center, everything else can kind of branch around that, including your messaging, your go to market, whatever you're positioning, and that makes a lot of sense. Brian, I think we have what we want for the podcast. I think what we want to do is move on to the rapid fire. It's usually how we end every episode. So it's kind of like a this or that kind of thing, and we can start whenever you're ready.
All right, let's go for it.
All right, cool. Coffee before emails or emails before coffee?
Strangely enough, I don't drink coffee, so it's going to have to be emails before coffee.
Easy enough. Sleep mask or blackout curtains?
Sleep mask.
Startup chaos or corporate structure?
Startup chaos.
Nice.
Same.
Book smarts or street smarts?
Street smarts.
Perfect 8 hours of sleep every night or unlimited energy no matter how little sleep you get?
I'd have to say perfect 8 hours of sleep because I know what a lack of sleep, no matter how you're feeling today, will do to your body over time.
Totally. Meetings, video on or video off?
Video on. Yeah, I think it's not always easy, but we're embracing virtual care, and so we as a company we try to embrace virtual. I prefer in person, but I also recognize that's not what everyone prefers. But I think you lose a lot without being able to see who you're talking to.
For
And
sure.
that
You
was
gotta
probably the
see
longest
the
answer
face.
you've ever had on rapid fire.
No, we've had some long ones. Definitely not. All right, last one. Netflix binge or live sports game?
I'd say live sports game.
For sure. Cool, man. Well, thanks so much, Brian, for joining. If anyone wants to reach out to you or Gem Health, how can they get in contact with you?
Yeah, you can connect with me directly at brian@gem.health, or you can reach into info@gem.health as our two email addresses. Probably easiest, or just check us out on www.mygemsleep.com.
Awesome. Brian, thanks so much for joining today. We had a great time, and hopefully we could do this again.
Thanks, Alex.
Thanks,
man.
Brian. Appreciate it.